let's talk a little bit about your work and the testing that you're doing at an advanced level and linking that to mental and metabolic health, because you have the mental map, cutting edge lab panel for mental health. Can you go into what that is and what you're looking at with the mental map?
Yeah, absolutely. It's been a huge passion project because, I started doing blood work on my clients when I was 18 as a personal trainer and nutrition coach, really from the perspective of, not that I was like trying to treat the biomarkers. It's just, hey, weight loss client that wants to lose 50 pounds in 6 months. Like, we're not going to use the scale to measure progress. We're going to use your VO2. I'm going to make you run on a treadmill and see how much gas you have in the tank. I'm going to measure your body fat with a $10,000 machine. I'm going to run some blood chemistry because I guarantee you, your lipids, your glucose, your insulin, your liver enzymes, those are all going to be more sensitive markers of progress. So if you're just counting your push-ups or, waiting to fit into that, dress that you want to put on or whatever, so I did it more from the psychological and having sensitive, objective data to validate like what we're doing in the gym and in the kitchen and lifestyle. It's working. So let's keep going. So that's how it started. And then I didn't even know all these like functional lab tests existed until a little bit later in my career. And then it's like all these urine tests and hair tests and stool tests. And, I mean, I dove head first into that world, but the deeper and deeper I got, the more I realized like, if these tests are so functional and so great, why are they not used in healthcare? Is it that it's the newest, greatest thing and it just hasn't really been validated enough to the rigorous criteria of conventional healthcare? Or is it a bunch of BS and time will tell, right? So this is where I do think there is a little bit of a functional lab test craze. And a lot of these functional lab tests really do not have established clinical significance or reliability or efficacy. And so if we're demanding our clients and patients are dropping 500, 2K, 10K, whatever it is on these functional labs, but we're not using clinically established data, what are we doing? So my goal with the mental map was I'd been running custom blood panels on all of my clients for years and years and years. And the majority of my clients for the past 5 years have all been mold cases primarily. They have other things. They've got Clostridia, they've got toxicity, they've got insulin resistance, whatever. But I started running these custom panels looking at a lot of key like nutritional, inflammatory, immunological, methylation, oxidative related markers. And I was having so much success with it that I was like, I need to like create my own custom panel and brand it and get it in the hands of other providers and train people on it. Because I'm a mentor for a lot of practitioners and it's too hard to try to teach them how to build their own custom panels. It needs to just be, here's the test, order it, here's how to interpret it, here's how to build a protocol. So that's kind of how it all started with the mental map, but it's a panel that's looking at key markers that even are established in the literature of being reflective of things like methylation, which regulates epigenetics and brain chemistry and all sorts of cool things, and detox, inflammatory markers to assess for microglial activation, which is microglial cells. They are the immune cells of the brain that run the show in regards to they regulate neuroinflammation, and every bad mental illness, neurodegenerative thing is driven by neuroinflammation, but they also regulate neuroplasticity and neurogenesis, which is how the brain heals itself. So the whole test and panel was designed around how can we effectively measure neuroinflammation, microglial activation, suppressed neuroplasticity, imbalanced neurotransmitters. And so there's a lot of core markers that I think are unfortunately underutilized, even though they're very established, they're very reliable, they're very sensitive, and they're very accessible. Every LabCorp, every Quest, you can run these markers, just nobody is. And the way that conventional uses these markers is very different. They'll use some of these markers as like, prognostic markers for cardiovascular disease or whatever, but they're not up to date on the literature. We have so much great science in the past 10 to 20 years that expands our understanding of how we can apply these markers clinically. So that was kind of the whole angle. And I think it's a super exciting panel.
Yeah. And I'm glad you brought up some of these points of, functional medicine sometimes gets the knock of just running massive amounts of panels and tests. Some, it's almost overwhelming right? And I think a lot of people that are new to functional medicine are just running thousands and thousands of dollars think more is better. When I've always been taught with doctors that less is actually better. The simpler you get to exactly what you want to see, and you could isolate things and really understand what is what, the better it is, even for the patient to understand. They don't want to be looking at 50 pages and one thing counteracts the other, and it makes no sense to them. And in all reality, the doctor's really just kind of throwing darts in the dark at what panel is what. So I really like getting to the smallest amount of information that's the most pertinent information. And I think that's where functional medicine will lead, not more and more and more data, just better data, more accurate data that helps you uncover underlying issues that you could then reverse disease with.